Hello students, this is SriRam Shastri. So once again I welcome you back to the second protozoan disease, that is amoebiasis, also called as Amoebic dysentery or also called as Amoebiasis. The causative agent for amoebiasis is Entamoeba histolytica. It's a type of protozoan. The site of infection is the large upper intestine, and transmission is from the cyst of an infected person's stool. That is, the people who do not follow Swachh Bharat Abhiyan and those people who defecate outside in the environment, they generally what you call as transmit this disease if they have the infection. So stages are trophocyte or magna stage, which is also called as the feeding stage, and minuta or pre-cystic stage. The cyst stage is the infective stage for human beings. The symptoms of amoebiasis are pain in abdomen, indigestion, loss of weight, and anemia, ulcers in the intestine, abscess in the liver, lungs, testis, or brain. In severe cases, when the treatment is not done properly or if it is unnoticed for a longer time, then abscess is collected. Abscess means pus formation and swelling inside the internal organs can take place, especially in the liver, lungs, testis, and brain. If they are not treated for a longer time, it can lead to death. These are some of the other diseases of protozoans, like the first one, sleeping sickness, also called as African sleeping sickness, caused by Trypanosoma gambiense or Trypanosoma rhodiense. There are two species of Trypanosoma. It's a flagellated protozoan. Generally, it requires a vector called as the CC fly. CC fly acts as a vector for transmitting the African sleeping sickness. Again, if you talk about this, it is endemic type of disease to Africa, and mainly it affects the central nervous system, and it's a very severe disease there, and it can result in death if it is not treated properly. Coming to kalaazar, also called as black fever or dum-dum fever, caused by another flagellated protozoan called Leishmania donovani. Leishmania donovani is being transmitted again with the help of a vector. The vector here is sandfly. Sandfly is a vector which transmits this disease called kalaazar. Generally, here the symptoms include blackening of the skin. There will be fever and blackening of the skin takes place, and if it is not treated for a longer time, it can lead to death. Again, coming to third one, that is ciliary dysentery. Belantidium coli is a type of protozoan. Again, it can also cause a type of dysentery called as the ciliary dysentery. Then giardiasis also is a type of dysentery caused by another type of protozoan called Giardia intestinalis. So polluted water bodies and consumption of water which is not filtered or processed properly can lead to Belantidium coli infection or Giardia intestinalis. These two are waterborne diseases rather than vector-borne diseases. So whatever may be the what you call as type of disease, here precaution is always better than the cure. What we can do for precaution is always try to consume fresh water. If it is tap water, try to boil it, or if you have a filter it and then consume. Do not consume the water directly, as there are chances, especially in the rainy season, there are chances that the water bodies can get contaminated severely because of heavy human population and can be leading to spreading of several diseases. So we'll stop this video here itself, and the next video will continue with the another category of diseases, that is helminthial diseases and fungal diseases. Thank you.